My name is Laurie Merritt, and I'm a home visitor at the Family Visitor Program, and I'd like to speak about breastfeeding. Breastfeeding is a wonderful, natural, healthy way to feed one's child. It's recommended by organizations such as the American Academy of Pediatrics, the World Health Organization, the United Nations Children's Fund, among many organizations. Mothers are designed to breastfeed, and babies are born to breastfeed. The benefits are numerous, and the benefits apply to mothers and babies. Some of the breastfeeding benefits for mom include moms are healthier physically. They lose weight much quicker after the birth, as breastfeeding burns about 500 calories a day to build and maintain a good milk supply. It causes the uterus to contract and get back down to its right size, normal size, less postpartum bleeding, fewer urinary tract infections, less chance of anemia. Emotionally, breastfeeding is wonderful for mothers. When new moms breastfeed, they release two hormones, oxytocin and prolactin, which are called the feel-good hormones, the love hormones. And what makes a mom fall in love with her baby, bond with her baby, and these hormones also help a mom to be calm. It helps with postpartum depression. It helps with self-esteem and confidence. For new moms, breastfeeding may lower the risk of breast cancer, uterine cancer, ovarian cancer. It lessens osteoporosis and the risk of hip fractures as women age. It's wonderful for moms. It's free, it's convenient, no bottles, no shopping, no preparation. Wherever you go with your baby, you have the baby's food and milk. You don't have to worry about taking the bottle of formula with you. It also helps with self-esteem, and that it gives a new mom a wonderful feeling of accomplishment, that she is able to feed her baby and produce the best food for her baby. It really does build her self-esteem. It makes her feel proud that she can give the baby what the baby really needs. She's able to comfort her baby because she is bonding and holding and caressing the baby when she's breastfeeding, and this is wonderful for her and the baby. The benefits for the baby are numerous. Breastfed babies are healthier from the start. Breastfed babies have stronger immune systems, less diarrhea, less constipation, less ear infections and colds, better vision, lower rates of infant mortality, possibly lower rates of SIDS, less hospitalization, less illness overall. And parents who breastfeed have much less absenteeism at work, which are good for employers. Breast milk is best for baby. It contains nutritional components that are natural tranquilizers for the baby. Also makes the baby calm, as it does for the mom. It's always clean, sterile, at the right temperature. It produces bowel movements that have a much less offensive odor than formula. Breastfeeding improves IQ. A clinical study shows that infants who are breastfed exclusively for the first 6 months of their life did test 11 IQ points higher than formula babies. Breastfed babies become healthier children. They have less allergies, asthma, eczema, fewer childhood cancers, lower risk of juvenile onset diabetes, less Crohn's disease and other chronic and acute diseases, lower rates of respiratory illness. They have better jaw and tooth development, fewer cavities, and they're less likely to become obese later on in childhood. For teens and adults that were breastfed, studies show they are less likely to develop rheumatoid arthritis, develop heart disease in adulthood, lower risk of multiple sclerosis, and lower rates of pre- and postmenopausal breast cancers. Breastfeeding is wonderful for babies, and it's a wonderful bonding experience for mothers and their babies.